How to naturally lower blood pressure during pregnancy. According to the American Pregnancy Association, high blood pressure affects about 6 to 8% of pregnant women. If your blood pressure exceeds 140 mm Hg systolic, the top number, or 90 mm Hg diastolic, the lower number, you suffer from high blood pressure or hypertension. Some risk factors for pregnancy-related hypertension include being overweight, having hypertension before pregnancy, pregnant with multiples, having a chronic illness, and/or poor diet, high salt and high fat diets. Because hypertension can lead to complications, low-weight babies, kidney problems, premature birth, and preeclampsia, you should take steps to reduce high blood pressure during pregnancy. 1. Lowering blood pressure with lifestyle choices. Get moving. Inactive women are at a higher risk of hypertension than those who exercise. So whether you are already pregnant or plan on conceiving, talk to your doctor about starting an exercise program. Try to exercise for at least 30 minutes a day or most days throughout the week. If you are a beginner, try low-intensity walking or swimming. Always talk to your doctor before starting an exercise program and ask if it is safe for you to do certain activities. 3. Monitor your weight. Being overweight is a risk factor for hypertension, and thus, you need to take caution to keep your pregnancy weight gain within healthy limits. A proper diet and regular exercise are ways to manage your weight gain during pregnancy. Preeclampsia is associated with hypertension and weight gain during pregnancy, so it is important to avoid gaining too much weight and to avoid gaining weight too quickly. Preeclampsia can lead to kidney and liver problems for the mother and complications for the baby. 5. Being overweight also increases the risk of other health conditions during pregnancy, such as backaches, exhaustion, leg cramps, hemorrhoids, gestational diabetes, heartburn and aching joints. Reduce stress. Being stressed can cause elevated blood pressure whether you are pregnant or not. Try eliminating known triggers for stress if possible. Do not overwork when pregnant. If you work over 41 hours per week, this can increase your risk for high blood pressure. 6. Try relaxation techniques such as meditation, visualization and yoga. These can bring serenity to your body and mind and help reduce your stress level. Try controlled breathing. Breathing techniques, such as diaphragmatic breathing, can help calm your body and mind and provide stress relief. In addition, by engaging the diaphragm, the muscle at the base of your lungs, you can make your breathing more powerful and reduce the strain to the other muscles in your neck and chest. Lie comfortably on your back or sit on a chair. If lying down, place a pillow under your knees to keep them bent. 8. To feel your diaphragm move, place your hands on the chest and below the ribcage. Slowly inhale through your nose so that you feel your stomach move up. Slowly exhale through your mouth by counting to 5 while tightening your abdominal muscles and letting them fall inward. Repeat and keep your breathing regular and slow. Listen to music. Studies have shown that listening to the right type of music while slowly breathing for at least 30 minutes a day can lower blood pressure. Listen to calming and relaxing music such as Celtic, classical, or Indian, or if you have a favorite slow music that inspires and relaxes you, listen to that. Avoid loud and fast music, such as rock, pop and heavy metal, as these might have the opposite effect on you. Take a closer look at your medications. Hypertension is a side effect of some medications. Talk to your doctor about your medications and find out if they are safe to use while pregnant. Stop smoking. Besides being a danger to your baby, smoking can also raise your blood pressure. If you are pregnant, you should quit smoking immediately. Talk to your doctor about methods to stop smoking that are safe for you and your baby. How to stop diarrhea during early pregnancy. Diarrhea and pregnancy usually go hand in hand, especially during the early stages of pregnancy. This is due to the fact that many pregnant women become more sensitive to the food they eat when pregnant. In addition, their digestive systems tend to process food more slowly, which can lead to diarrhea. As many over-the-counter diarrhea medications are unsafe for mothers during their first trimester, it may be necessary to find alternative methods of stopping and preventing the condition. This WikiHow article explains how to adopt safe, natural methods for stopping diarrhea. Stopping the condition using diet. Follow the brat banana, rice, applesauce, toast diet. The brat diet is great for pregnant women who are suffering from diarrhea as the foods it contains are low in fiber and easy to digest, but still highly nutritious. The brat diet is easy on the gastrointestinal tract and rarely causes diarrhea. Bananas are high in potassium, which helps to replace the potassium that is lost during diarrhea. Bananas also help to thicken the stool, which prevent diarrhea. Applesauce made at home using only apples contains pectin, which helps to thicken stool. It's also high in natural sugars, which provides energy. Rice and toast are simple foods which are easily digested. They also work as binding agents to thicken the stool. Eat plenty of soups and broths. Clear soups and broths contain no solid particles, so they require little to no digestion. This means that they are very unlikely to cause problems, making them a great choice for expectant mothers during early pregnancy. Eating clear soups and broths can be combined with the brat diet to ensure that you are getting all of your required vitamins and nutrients. When following this diet, try to eat 5 or 6 smaller meals a day, rather than 3 large ones, as this further decreases the chance of diarrhea and helps to keep your energy levels up. Avoid spicy and high-fat foods, as these are harder to digest. Spicy foods and food that contains high amounts of fat are much more likely to cause diarrhea, as they are difficult to digest and may irritate the gastrointestinal tract. Stay away from high-fat meat products such as bacon and fatty red meat. Instead, opt for low-fat proteins such as turkey, skinless chicken breasts and white fish. You should also avoid cooking with too much oil or butter. Stay away from spicy foods such as most Asian, Indian and Mexican cuisines. Avoid cooking with hot spices or peppers at home. Avoid dairy foods, except for yogurt containing live bacteria. Many women become lactose intolerant during pregnancy, which means that you may experience diarrhea after drinking milk or eating other dairy products. The one exception to this is yogurt containing live bacteria such as Lactobacillus acidophilus and Bifidobacterium. The organisms in the yogurt help to kill harmful bacteria in the digestive system that cause diarrhea. If you do eat dairy products, opt for the low-fat varieties, as these are less likely to irritate the digestive system. Keep a food diary to identify which foods cause diarrhea. Some women are particularly sensitive to certain types of foods during pregnancy, even foods that they ate on a regular basis before getting pregnant. As a result, it can be difficult to identify exactly which foods are causing the problem. Therefore, it may be a good idea to keep a food diary, where you make a note of all of the foods that you eat and the corresponding bowel movements. This will help you to identify which foods are causing the diarrhea, so you can make an effort to avoid them in future. Drink plenty of fluids. Diarrhea often leads to dehydration, as you are losing a lot of fluid through your bowel movements. As a result, it is important to drink lots of water to stay hydrated. Aim to drink a minimum of 6–8 ounces glasses of water per day, and more if possible. You can also stay hydrated by sucking on ice cubes or water-based popsicles, drinking plenty of herbal teas, and eating fruit and veg with a high water content, such as watermelon, cucumber, tomatoes, beets and grapes. How to increase iron levels during pregnancy. Iron has many uses and benefits your body in many ways. Especially while pregnant, high iron levels are needed in order to properly transfer oxygen throughout the body and boost the effectiveness of the immune system. 1. You can increase your iron levels by choosing iron-rich foods and taking supplements or medications. Boosting iron levels with dietary sources. Choose iron-rich fruits. Fruits are an important part of any healthy diet. They are also a great way to increase your iron levels. Get 2 to 4 servings of fruit every day to help maintain your iron levels. Prunes. Dried apricots. Raisins 4. Persimmons, raw. Mulberries, raw. Dates. Currants. Pomegranate. Watermelon. Strawberries 5. Select vegetables high in iron. Vegetables help form the cornerstone of a healthy diet. Many are high in iron and also have many important nutrients, such as folic acid, for you and your baby. Eat 4 or more servings of iron-rich vegetables every day to increase your levels and minimize the risk of anemia. Broccoli. Kale. Sweet potatoes. Spinach 8. Beet greens. Dandelion greens. Chard. Incorporate breads and cereals into your meals. One source of energy for pregnant women is cereals, grains, and breads. Getting 6 to 11 servings of breads and grains can boost your iron levels and energy. Enriched white bread, pasta, or rice. Whole wheat bread or pasta. Oat and/or bran cereals. Rye bread. Corn meal. Brown rice 11. Get iron from meat products. The iron in fruits, vegetables, and grains is an excellent way to increase your iron levels. However, they are not as readily absorbed as the iron in meat. Lean beef such as chuck roast 14. Lamb. Turkey. Chicken. Liver. Shrimp. Oysters. Sardines. Scallops. Mackerel. Consume beans, legumes and other iron-rich foods. Outside of the 5 food groups, there are other choices that can increase your iron levels. Foods such as beans, legumes, and even molasses, when purchased and eaten in a honey-like consistency, can help you maintain or boost iron levels while getting some variety in your diet. Beans such as kidney, lima, black, and navy. Lentils. Tofu. Peanut butter. Molasses. Sesame seeds 16. Almonds. How to avoid varicose veins during pregnancy. You're probably ready to experience a number of pregnancy symptoms, but varicose veins can be minimized with several simple adjustments. Varicose veins are swollen veins that are visible near the surface of your skin. Pressure from your growing baby and the increased volume of blood flowing through the veins can cause varicose veins, so preventing swelling and reducing pressure is important. You can make lifestyle changes to improve your circulation and eat foods that reduce swelling in order to avoid varicose veins. Making lifestyle adjustments. Get regular exercise. Varicose veins typically appear in the later stages of pregnancy, when the weight of the baby is pushing down on your pelvis. Try to do low-impact exercises throughout your entire pregnancy to keep your blood flowing and minimize your chance of developing varicose veins. Talk with your doctor about what exercises are best for you, especially during late pregnancy. Walking and swimming are good low-impact exercises. You could also try Tai Chi and yoga under professional guidance. You can also do foot exercises by bending and rotating your feet at the ankles. Bend, stretch, and rotate your feet throughout the day to keep the blood circulating well. Avoid sitting in the same position for a long time. Varicose veins are more likely to develop if your circulation is poor. This can happen if you have to sit in the same position for a long period of time or don't get to move around much. To improve your circulation, try to stand up and change positions occasionally. Don't cross your legs when you're sitting, since this can slow down your circulation. This also helps prevent blood clots. Elevate your legs. If you have to sit in the same position for a long period of time, try to elevate your legs occasionally. For example, if you have to sit in a chair, rest your feet up on an ottoman or small stool. This will release some of the pressure on the veins in your legs. If you can, stand up and go for a short walk before elevating your legs to improve your circulation. For a comfortable way to elevate your legs, stack several pillows under your feet and knees. Practice deep breathing exercises. Deep breathing is a great way to improve your circulation, relax, and prevent varicose veins. Sit comfortably with your feet elevated above your hips. You might try sitting with your feet raised up on pillows. Breathe in deeply, so your lungs are full. Breathe out slowly as you feel the air release from your diaphragm. Do this for 10 minutes every day. If you can, keep your chest in place as you breathe in. Your shoulders shouldn't move up or down as you inhale or exhale. This may become more difficult as your pregnancy progresses, so follow your body's needs. Wear flats or low-heeled shoes. If you frequently wear high heels or shoes with tight straps, switch to flats or shoes with low heels. Wearing high heels can actually increase the pressure on your veins and increase your risk for developing varicose veins. Flats or low-heeled shoes will allow your blood to circulate easier and keep your veins healthier. Some low, flat heels can reduce the amount of pressure on the veins in your calves. You may find that you need to buy new shoes anyway, since many pregnant women's feet swell during the final months of pregnancy. It's best to get fitted for your shoes to make sure they are providing the right support. Wear support hosiery for pregnant women. There may not be much you can do about the pressure your belly is putting on your body, but maternity support hosiery can help. These are thicker than standard women's hosiery and they're designed to be looser near your thighs while being tighter near the ankles. This will reduce some of the pressure from your belly and improve your blood circulation. You can find maternity hosiery at maternity clothing stores, pharmacies, and medical supply stores. Try to sleep on your left side if you can. A major vein runs down along the right side of your body. To prevent additional pressure on this vein, sleep on your left side if you can. You can also reduce pressure and swelling in your legs by sleeping with your legs elevated. Just lay a few pillows underneath your knees and ankles before you sleep. Don't worry if you roll onto your right side while you're sleeping. The important thing is that you're comfortable enough to get a good night's rest. Prevent vulvar varicose veins. Although most varicose veins develop on the legs, pregnant women can develop varicose veins in the vulva area, especially during the third trimester. If you begin to feel pressure or pain in the vulva area, elevate your hips using pillows. You can also place an ice pack in the area to reduce swelling. Talk with your doctor if you experience sharp pain or are concerned about vulvar varicose veins. It's best to have this area checked frequently if you are experiencing any pain or swelling.
How to reduce fatigue during pregnancy. Many pregnant women experience bouts of fatigue from time to time. You may feel sluggish and tired and your energy levels will be lower than normal. At times, the fatigue can be so overwhelming that you may be unable to be productive at work or keep up with your normal activities. Often, fatigue is most noticeable during the first 3 months and the last 3 months of pregnancy. Normal hormonal changes cause some of these symptoms, and the extra strain on your body to accommodate a new life is also part of the cause. In addition, you may have a disrupted sleep pattern or psychological changes that make you feel mentally as well as physically drained. It is very important that you receive regular prenatal care and stick to a healthy diet. However, there are other things you can do to reduce fatigue. Eating to reduce fatigue. Take your prenatal vitamins. Pregnant women have many increased nutritional needs, and if you don't get the proper nutrition, you are more likely to feel fatigued. Prenatal vitamins are specially formulated to help supply the additional nutritional needs for pregnancy. Remember to take them every day. Be sure to use a prenatal that contains vitamin B12, which helps fight fatigue. Also be sure that your vitamin contains at least 27 grams of elemental iron. Pregnancy-induced anemia can cause extreme fatigue for some women, and if your doctor tests your blood and determines that you have this condition, you may need to increase your iron up to 60 grams a day. If you have trouble remembering to take your prenatal vitamins, set them on your dining room table or wherever you eat dinner every day. You can also try setting a timed reminder on your phone to sound an alarm every day when you need to take your vitamin. Eat for energy. Pregnant or not, the body gets its energy from food. A healthy diet can make the difference between chronic fatigue and energy. You need 3 major macronutrients for energy: protein, carbohydrates, and fat. Protein provides much of the energy your body needs to do the hard work of growing a human. When pregnant, you need about 70 grams of protein every day, considerably more than the 45 grams recommended for non-pregnant women. Consider healthy food sources such as beans, dairy, tofu, chicken, and fish. Carbohydrates often get a bad reputation, but in fact they are one of the body's main sources of energy and vital to your health and ability to fight off fatigue. About half of your daily calories should be from carbohydrates, but remember to choose healthy sources like unrefined grains. Fats provide the most concentrated form of energy, and also help you to absorb some vital vitamins. While pregnant, you need to ensure that about a quarter of your daily calories come from fat. Avoid low-fat and reduced-calorie food options, which don't provide as many energy-filled calories to fuel the body. Eat healthy, whole foods with naturally occurring fats like avocado, nut butters, vegetable or coconut oil. Avoid margarine and saturated fats. Eat several small meals. Instead of eating 3 large meals a day, increase the number of meals you eat, but reduce the amount of food at each meal. This gives the body more boosts of energy throughout the day to fight pregnancy-induced fatigue. Despite that popular cliche, eating for 2, you should double your food intake while pregnant. Instead, increase your caloric intake by about 300 calories per day. Make sure your added calories contain protein and carbohydrates for energy, but ensure that they are nutritious calories and not junk food. For example, 300 nutritious, fatigue-fighting calories can be found in an apple, sliced and spread with your favorite nut butter, or in a cup of Greek yogurt with a handful of almonds and berries. Increase your water intake. It can be hard enough to drink enough water for non-pregnant women. During pregnancy, you need to increase your intake of water substantially to combat dehydration and fatigue. In fact, one of the first symptoms of dehydration is fatigue. Aim for a dozen 8-ounce glasses of water a day, if you live in a temperate area. In hot, humid areas, you will need even more. If you have trouble stomaching all that water, add some variety to make things more interesting. Try adding fresh fruit to your water or drinking non-caffeinated tea. You can also eat juicy fruits and vegetables like watermelon, lettuce, or tomatoes. Try to not drink water 2 to 3 hours before bedtime to reduce the urge to get up to urinate. Aim for a dozen 8-ounce glasses of water a day, if you live in a temperate area. In hot, humid areas, you will need even more. If you have trouble stomaching all that water, add some variety to make things more interesting. Try adding fresh fruit to your water or drinking non-caffeinated tea. You can also eat juicy fruits and vegetables like watermelon, lettuce, or tomatoes. Try to not drink water 2 to 3 hours before bedtime to reduce the urge to get up to urinate. Don't rely on caffeine for energy. Even if you drank lots of caffeinated beverages prior to pregnancy, it's important that you only consume a moderate amount of caffeine while pregnant. Studies have shown that it is safe to drink a small amount of coffee, black tea, or hot cocoa while pregnant, but keep it to a minimum. Limit your caffeine to no more than 200 milligrams per day. That's the amount found in 1 12-ounce cup of black coffee or 4 cups of black tea. Never drink energy drinks, energy shots, or pure caffeine while pregnant. These have questionable health risks even when you're not pregnant, and are linked with miscarriage and birth defects.